Greetings, Batch 15, and welcome to today's session of your respiratory system course. We're going to be discussing the topic of surface anatomy of the respiratory system. I've just put together the points that I think are important for you guys to know in regards to this topic. And just like I did last time with your last lecture, I've divided it into short segments so that the videos are easy for you to follow along. And with that said, let's get started. And before we do, we need to ask one important question, and I'm sure you guys have some idea about this already, but we need to know what surface anatomy is and why we focus on it and study it in the first place. So I'm just going to give you guys like a minute or two to maybe jot down some thoughts, think about that, and then we'll continue and, hopefully help this guy out of his confused state. Okay, so the idea is that when we're dealing with humans, when we're dealing with patients, um, they obviously come to us with certain complaints, and we can't exactly open up. Well, I mean, unless you're certain, obviously, and the patient's under anesthesia, but under normal circumstances, we can't exactly open a patient up and then look inside to find out what's going on. So, in order to diagnose our patients and figure out their problems and what's wrong with their body, we need to rely on our knowledge of anatomy and where everything is found in the human body as it relates to the external surface. So I need to know that, for example, the top part of the lung is found here, but the bottom part is found in this specific region, and say the heart is found in a certain place, and the stomach is found in a certain place, so that when a patient says that this place hurts, or, this thing itches, or whatever, we can figure out, well, okay, this is what's found in this region, so and so and so is probably what is wrong with you. So, having said that, knowledge of anatomy and surface anatomy is very important because the simple truth is that when you're dealing with a patient, you can put your stethoscope wherever you want, but you can't fake it. You either know where something is or you don't know. And that's why anatomy and surface anatomy specifically are very important. All right, so let's just dive right into today's topic. And first of all, we're just going to look at some vertebral levels. You guys know that vertebral levels are really important in anatomy. And so what we're looking at here is a side view of the thoracic wall and cavity. Okay, you can see the 12 thoracic vertebrae here at the back. You've got the sternum anteriorly, and this is the diaphragm inferiorly. Okay, so if you guys remember with the anatomy of the sternum, we had a small notch at the upper border of the sternum, which we called the sternal. Sometimes it's called the sternal notch. You can call it the suprasternal notch. It's also referred to as the jugular notch. Okay, so keep in mind that that's found at the level of T2, or the intervertebral disc between T2 and T3. Okay. The junction between the manubrium and the sternum, which was called the angle of Lewis, which was called the sternal angle. Remember, that was the point of the thoracic plane. Okay, so that was found at the intervertebral disc between T4 and T5. And then here you can see where the xiphisternal joint and the xiphoid process are found roughly at the level of T9. Okay, we're going to move on to the trachea, and we're just going to go through a quick recap of the anatomy of the trachea, where you guys should know by this point that the trachea is a tube that is part of the upper respiratory tract. It's a continuation of the larynx, and it usually begins at the level of C6. It passes down the neck and part way down the thorax, and then what it does is it divides into two separate tubes leading into each of the lungs. The trachea is a cartilaginous structure, meaning that it is made up of cartilages, and these cartilages are not found in a continuous structure, but what they are separate rings that are held together by excuse me, that are held together by membranes. Okay, so basically air is going to pass through the nasal cavity, through the larynx, and then it's just going to pass down the trachea until eventually it reaches the two lungs. Okay, the trachea has a cervical portion, which is part of it that is found in the neck, and it has a thoracic portion, the part of it which is found in the thorax. Now, in this cross section here, you can see how the cartilages of the trachea are situated separately, and this is the membrane in between them that holds them together. And one of the important things that you need to notice is that the trachea is made of C-shaped rings. So this cartilage starts here, it curves around in a C shape, and then it ends right there. And the importance of this shape or this arrangement is that it provides external support for the trachea and maintains the patency and opening of the lumen. Now, an organ that comes in close contact with the posterior aspect of the trachea is the esophagus, which is a muscular tube that's part of the gastrointestinal tract. And so, since the tracheal rings are C-shaped, that means that the back part or the posterior aspect of the trachea is not made of cartilage, but instead it's made of a muscle that closes off this posterior part, and this muscle is called the trachealis. So that means that instead of the esophagus being blocked off by a type of tissue that is stronger than it anteriorly, the part of the trachea that comes in contact with the esophagus is made of exactly the same type of tissue. And that way, whenever food is passing down the esophagus and it's expanding or changing its shape, it can do so comfortably because there's muscle found in front of it, so it can expand as needed. Now, with this picture, what I want you guys to notice is that there are certain parts of the human body that are what we call subcutaneous, meaning that these are structures that are found directly underneath the skin, and if you palpate this region, you can feel them. So one of the things that you can palpate under the surface of the skin at the upper part of the chest is a bone that's called the clavicle. And this is a bone that's actually part of the skeleton of the upper limb, but it does articulate with the sternum here at the sternoclavicular joint. You can palpate the suprasternal notch, so we know that we're at the level of T2 at this point. And if you pass your fingers up the center of the neck, you can actually feel the tracheal rings at this point, as seen right here in this picture, okay? And these are the clavicles that I said are subcutaneous. The other thing that you can palpate subcutaneously is the sternal angle, so you can actually feel a slight elevation at this point. So here, this is when you find the sternal angle, you know you're at the level of T4. And the importance of T4 for the trachea is obviously the level where it terminates or bifurcates into the two main bronchi. So, the trachea commences at the level of C6, and it will continue down to bifurcate at the level of the sternal angle at T4. It is palpable, like I showed you in the picture, it is palpable in the midline if you start from the suprasternal notch and then continue palpating upwards. One of the things to keep in mind is that the level of bifurcation varies with position and the phase of breathing. So if a person is standing up, lying down, the tracheal bifurcation changes level. If a person has taken like a really deep breath and full inspiration, that changes the level of the bifurcation as well, and it can actually go as low as T6. All right, so that wraps up this part of the lecture, and we will continue with the rest of this session in the next video.